As we head into what many do consider a high-risk twindemic season of flu and COVID-19, many are concerned we will continue to lose more lives. This morning, President Donald Trump tweeting about it, saying, among other things, sometimes over 100,000 people a year die from the flu, and that COVID in most populations was far less lethal. Twitter flagged the tweet, saying it violated Twitter rules, but left it up, saying it was in the public's interest for it to be accessible. So what should we know about flu deaths? The first thing to know is that in the last decade, according to the CDC, flu deaths have not topped 100,000 in the U.S. Last year's toll may have been as high as 64,000, however, which means, as of right now,
COVID is still a much more deadly illness than the flu, probably at least 10 times as lethal as standard influenza. But certainly a lot of people do die from the flu.
The second thing to know is that, as President Trump pointed out, we don't shut down the economy for the flu. We do, however, already have a vaccine to protect against it. Only about half of us each year choose to get that vaccine. This year, with the coronavirus and the flu colliding, public health experts are hoping that number will climb. There will be no shortage of flu vaccine.
This year, CDC's purchased an additional 9.3 million doses of adult flu vaccine, as well as 18.5 million doses for children. This is a significant increase in previous years.
Finally, infection control specialists tell me something else we all should know. You can be infected with both the flu and the coronavirus at the same time, which means no matter the death toll.
I think everyone should be respectful of the flu. Let's put it that way. I mean, it can be a very severe disease. People with the flu can have a bad outcome. Older, more frail patients, patients with medical illnesses can die from the flu. So it should be respected and prevented as much as possible.
Halloween decorations are going up in neighborhoods across the valley, but to avoid the spread of COVID-19 in our communities, the Southern Nevada Health District wants you to know there are safer ways to celebrate the holiday.
It's so important because you can't take away Halloween.
As a mother of two growing girls, Christy Berardi fears this may be their last year of trick-or-treating as a family.
Through the neighborhood, it's been kind of lackluster when it comes to the decorations.
So she took to the app Nextdoor to ask Las Vegans, will you be canceling Halloween this year?
I got a lot of positive replies from neighbors. I think I reached out to about 45 communities.
Families hoping to keep Halloween happening, but with health and safety top of mind.
We're gonna walk through the neighborhood. I'll put my bowl out with pre-packaged candies in case some kids come down this way.
The Southern Nevada Health District echoing the night of jack-o'-lanterns, ghosts, and goblins lives on.
It's just a little bit different than it's been in previous years.
Their primary goal is to prevent the spread of COVID-19. If you're sick or have been exposed, stay home.
Homeowners can do things like put visual cues out to make sure that people aren't coming right up to their front door. You can put out a table with candy on it so people can kind of do a self-serve thing.
And health officials say stick with your household members while trick-or-treating. But the biggest tip of all, wear a mask. And that doesn't mean the spooky kind.
Even if you're wearing those big, spooky latex masks, a lot of them have large ventilation holes in them that'll allow those respiratory droplets to come out.
And before diving into candy treats, remember to stay COVID-19 vigilant.
Make sure you're using hand sanitizer pretty frequently throughout the evening. And of course, as soon as you come home, wash your hands before you dig into the candy.
Tiffany Lane spoke with different groups around the valley who are counting the costs of having larger crowds.
You need state approval to be able to have more than 250 people at an event, and that means that conventions can have up to 1,000 people, and places like T-Mobile Arena can have up to 10% of their capacity.
We can already feel the buzz. Our phones have been ringing, which is something nice to hear.
The Plaza Hotel and Casino in downtown Las Vegas already rolling out plans to welcome back meetings and events to its convention space.
The 30,000 square feet is our main ballroom, Sierra Ballroom, and we do have the floor-to-ceiling air walls that the governor has asked to be part of the plan.
Conventions can have up to 1,000 people, but cannot be in groups larger than 250.
Logistically, to put together an event for 1,000 people, we would have to do 4 simultaneous sessions. So the cost is prohibitive. At the same time, The whole point of having face-to-face meetings is really to have the whole group intermingling with.
Larger venues with more than 2,500 seats have even more requirements, like keeping sections independent from each other to stop people from going into other areas.
You don't build millions of square feet of convention space or large event space or auditoriums or arenas to run 10% occupancy. I just don't believe it's feasibly possible to be profitable.
Smaller shows also preparing to start up again, including popular adult revue show Fantasy at the Luxor.
We haven't been doing anything for 6 months, so anything will be an improvement, to where we are. And the most important thing to me, obviously I run a business, but to get the cast back to work.
As for the changes,
we're disinfecting the theater every show. After every show, you have to wear masks. You will be seated socially distanced. We will not be going into the audience.